Have you heard of the ACO at UH? Dr. William Steiner has joined us here in the University Hospital's Broadcast Center to decipher just what those letters stand for and why they spell out better patient care. Dr. Steiner is the president and medical director of the Accountable Care Organization. That's the ACO part at University Hospitals. That's the UH part. So welcome to the show. Glad to have you here.
Thank you very much for having us.
So what is an Accountable Care Organization, and why should patients really care about that?
Well, the Accountable Care Organization at University Hospitals actually started in 2011, was one of the first in the country. We now care for over 300,000 patients, and by one of the last accountings, we're the 5th largest in the country.
Wow.
Our goal is to promote and support health care for our patients and to help coordinate that care between the patient and their physicians as well as their other health care professionals.
Okay. And so what areas do you concentrate in then?
Well, we, as I say, help coordinate that, but we have everything we do is with the so-called triple aim of healthcare in mind. That is to improve the quality of patient care, improve the patient experience with their health care, and lastly, improve the cost effectiveness as well.
Okay, and you must have to be proactive when you're doing that.
Well, we do. We actually have a fairly large staff. There's almost 50 people in the ACO.
Wow.
And
you need that for 300,000
You do.
patients.
The largest number of those people within the ACO are what we call patient navigators. And they do just what their name implies. They help the patient navigate through what sometimes can be a daunting system, particularly when they're ill. Many of those patient navigators are actually in the doctor's offices where they may meet with the patients either before their appointment or after their appointment. They may help them schedule an appointment with a specialist, whether it be at the Seidman Cancer Center or some other specialist in one of our Institutes of Excellence. They may help them find places to get their medications. They assist the patients in a whole variety of ways. In addition to that, we also have nurse care coordinators. Now, they work centrally in our main office, and they contact people primarily through the phone. But they help contact or touch base with every single ACO patient who comes out of the hospital. We try to have them meet or talk with the patient at least 24 to 48 hours after discharge. They also talk with every patient who comes out of the emergency room, even though they weren't admitted. Maybe they'll help them find out about their medications or where they can go to get their medications, set up their next appointment, but do everything we can to not only improve their condition at the time, but to prevent readmissions or unnecessary trips back to the emergency room.
Sounds like a very good thing for the patients.
Yeah.
So it sounds like it's a big team of people all working together.
Exactly. Not only do we have those folks, we have a pharmacist who helps people with their medications, maybe answers questions as to how to take their medicines. As you well know, particularly some of our older patients may be on quite a number of medicines, 5, 6, 8 different medications. They get confused. They don't know how to take the medicines, what interactions. Our pharmacist helps with that. May also help them find less expensive medications. Okay. We also have a social worker who helps people overcome barriers to their care. We had just a really tremendous example just a few weeks ago, right before Christmas. One of our patients came to their primary care doctor's office, and when the doctor went to examine this patient, it was an older woman, her skin was almost ice cold to the touch, and her heart rate was barely 45 beats per minute, and was all consistent with beginning of hypothermia. He called in the patient navigator. We were able to determine that, in fact, the woman's heat hadn't been on in her apartment for the last several weeks. She called the social worker, and by the end of that afternoon, the patient had her heat back on.
Great story.
Yeah, we take care of lots of people, but we still take care of them one patient at a time.
Excellent. So, University Hospitals Accountable Care Organization, or UHACO, is a healthy team approach to improving patients' health. My thanks to Dr. Steiner for teaming up with us today to tell us about it.
Thank you for having me.
For more information, call University Hospitals at 1-866-UH4CARE or log on to www.uhhospitals.org. Next,